because I feel like a lot of people use the technology as buzzwords, but they use it in suboptimal ways or arbitrary ways. So where's the real power of technology when it comes to preventative health that you've seen, at least working on the difference?
All right. Not just for the difference, but knowing kind of the space. The ways that I think could you take a 10 or 15-minute walk at lunch? And lastly is integrating kind of behavioral and physical health. The integration of those two things would certainly be helpful in terms of preventable and behavioral health. And at the difference, one of the main things we're focused on is really that first thing that I mentioned, which is predictive analytics. Integration with wearables, kind of AI related, in the sense of you have to make sure that our app is talking correctly to, let's say, your scale or your Aura Ring or your mobile device, and interpreting the data that these wearables are collecting. So I really think you're right. There is a real room for improvement in reducing the barrier to entry of time that it takes for users to enter their data into the app.
Shifting to preventative care, like instead of people go to the hospital when things get too bad, and then there's a hospital system and an insurance and all this bad stuff. Instead, people with the Aura, people with the Whoop, people with the difference, taking taking advantage of what they can.
The app is built for anyone, but non-Hispanic Black women in the United States suffer more acutely from weight problems, obesity, and comorbidities like type 2 diabetes, etc., than other demographics. So, you know, if we're hyper focused kind of on a segment.
All right, everyone, welcome back to the Digital Health Transformers podcast. This podcast explores the ever evolving world of healthcare innovation, one conversation at a time. I'm your host, Marty, and today we are joined by a truly distinguished guest whose work is all over the place. We have healthcare, technology, finance, and that amazing guest is Peter Conroy. He is the founder and CEO of TheDifference, which is a predictive, intuitive, and affordable weight management app that is focused on improving your health. It's focused on making you look better, making you feel better. I'm from the U.S., so weight's a big problem here, and it's great that Peter's solving that with his amazing app. He's a complete polymath. He's got experience in finance, quantitative bond market analysis, healthcare advocacy, technology. He's really just a beast. He was in Wall Street. He had a lot of entrepreneurial ventures, and he spent over a decade focused on health advocacy, awareness, and developing solutions like TheDifference to improve preventative and behavioral health. So join us as we explore how technology is reshaping preventative and behavioral health, the latest trends, key tools, and the trade-offs that healthcare leaders like our guest Peter face. So thanks for joining, Peter. How you feeling today? Where you calling from?
I'm feeling great, Marty. Thanks for having me on your podcast. I'm located in New Rochelle, New York.
All right. Is that upstate?
It's in Westchester, so it's the first county above, right above the Bronx, and the Bronx sits right on top of Manhattan. So we're about half an hour, 45 minutes away from Midtown Manhattan.
Gotcha, gotcha. You probably go to the city a lot, have some fun.
I do. I frequent the city. Yes,
Oh, nice. Yeah, good food around there and stuff. Yeah, I'm
very
Jewish, so there's
good
a lot of
food.
good delis over there. That's nice.
Hmm.
All right. Well, we can start with the first question. So I just noticed your career path is insane, right? You have finance, you have tech, and you have healthcare, and you have some nonprofit work. It's really just all over the place. It's really great. But I'm wondering then, out of all your interests and skills that you have, what has led you to work on a health app right now? Why a health app right now? Why is that the overarching factor right now for you, health?
Right. Well, as you pointed, first of all, I am a health advocate. And before I started The Difference, I actually moved into the field of health advocacy about 10 years ago. And I did that in a volunteer kind of charitable capacity with my fraternity, which is Kappa Alpha Psi Fraternity Incorporated. It's one of the oldest Greek letter organizations that was founded by African Americans at Indiana University. And my local chapter, the New York alumni chapter, they didn't have a health and wellness committee. And I had done some reflection about what was becoming more important to me around that time. And I was seeing people get sick and pass away. And I realized that health and longevity and quality of life were really becoming more important to me. So I asked the then president of the chapter to form a health and wellness committee, and he did, and he named me chairman. And I had a great time, just off to the races, doing things like blood drives and charitable fundraising for the American Heart Association and the American Cancer Society, holding awareness webinars for things like prostate cancer. Just had a really, really good time and discovered my calling in healthcare. But I, like 170 other million Americans at one point during that 10-year period, got significantly overweight. And I decided I wanted to do something about it. I wanted to lose weight, but I wanted to use an app. So I took a look at the app marketplace, and what I discovered led me to make the decision that I think I can do something better. And I'll talk about that story in more depth. That came to pass, and I built a company out of it called TheDifference, a weight management app company, and our motto is weight management simplified.
Yeah, and hey, Peter, you look great right now. Just in the Zoom call, I see those shoulders popping out. You look good now. So, whatever the difference does, whatever your methodology is, it's clearly working. To all the viewers out there, so check it out. Also, the UI is real nice. The problem I've had, I get, because I go to the gym, right? I'm like, once every month I get inspired to take a quantitative route, and start going on websites and plugging in my numbers. Like, how much should I eat every day? How much should I be lifting? But then they're like, enter your height, your weight in decimal points, your this, you're that, you're this, you're that, you're this. I just have to keep entering stuff, like too many stuff. Like, um, but with the difference, like I signed on, right? And then just immediately it was just very simple. I just entered height, weight, what weight I am now, target weight, boom, and I'm already started. It was great.
Mhm.
So, um, so anyway, just
Thanks for
wanted to
that
say I like
feedback.
the app.
Great, thank you. Yeah,
But
it's actually
yeah,
it's actually one of the cornerstones. You mentioned earlier, predictive, intuitive, and affordable. It's that intuitive kind of pillar. We've tried to design the app, and really a lot of all the decisions that we make at the difference, we try to make them sensible so that it doesn't take a lot of time to use it and it makes sense. It's intuitive when you start using it. So thanks for that feedback.
yeah, no, it really, because I'm in the Bay Area. All my friends are founders and whatnot, techie people, and a lot of techies, they make apps, kind of subconsciously, I think, believing that everyone else is a techie, right? And so they have all the technical stuff and terms, and like, oh, of course this person would know the API, whatever, but they don't. But your app, like, it's just very, I don't even have to think. I just open it. It's a great app. Anyone listening needs to get this app. It's really awesome. Even if you're not trying to lose weight, might want to maintain. It helps you track your diet. I love the app. Um, but yeah, I guess we can go over to the next question. And all right, the
Sure.
buzzword of the day is AI, right? Um, AI is it can do a lot of things, right? And compute can do a lot of things. But from your perspective, where can AI, where can compute, where can modern technology actually be applied to preventative health today? Because I feel like a lot of people use the technology as buzzwords, but they use it in suboptimal ways or arbitrary ways. So where's the real power of technology when it comes to preventative health that you've seen, at least working on the difference?
All right. Well, not just for the difference, but knowing kind of the space, the ways that I think AI is kind of integrating and transforming and the cutting edge stuff. It relates to predictive analytics, as well as AI is very good at pattern recognition, and pattern recognition is what you need for early risk detection. So that helps with preventative health. Also, we're aware of a lot of the passive monitoring via wearables and smartphone sensors. You got things like the Aura Ring. You've got diabetes, A1C1 measurement levels. You've got heart rate monitors. Even your phone, is tracking your steps if you want it to. The next thing is personalization and context-aware interventions. Those kind of get, triggered when pattern recognition kicks in. So let's say, like your goal is to have 10,000 steps a day and you're only at 6,000. Well, then around lunchtime, you might get a notification from your phone saying, hey, you're only at, 6,000 steps today. Could you take a 10 or 15-minute walk at lunch? And lastly is integrating kind of behavioral and physical health. The integration of those two things would certainly be helpful in terms of preventable and behavioral health. And at the difference, one of the main things we're focused on is really that first thing that I mentioned, which is predictive analytics. When I took a look at the app marketplace, what I found is that, in my opinion, the mathematics of these weight management apps and technology was rather outdated. A lot of the formula hadn't changed for decades, if not almost a century. And I'm an academically trained mathematician, also in applied mathematics, from a professional standpoint. You mentioned my background in bond analytics, which is heavily quantitative. And so my approach with the difference, one of the things that does make it stand apart is its predictive analytics. We developed core intellectual property with advanced AI machine learning formulas, such as our true burn formula, which we purport is a more accurate measure of resting metabolic rate, and our activity burn formula, which is a more accurate measure of calories burned while you're exercising or when you're being non-sedentary. But yeah, those would be the four things: predictive analytics, early risk detection, passive monitoring with wearables, personalization, and integrating behavioral and physical health.
All right, yeah, it's cool seeing that those finance skills in a health context, right? So you went from predicting the price of bonds to predicting the metabolic effects of someone's routine. That's cool. Who else does that? That's pretty cool.
And
Um
it's not
yeah.
just that. It's not just that. It's that, you're right. In finance, when you write research, which I wrote a lot of, you can't just say, here's what's going on with this company or this bond. You have to sum it up and say, this is a buy or this is a sell or this is a hold based on some type of expectation of where the price of that security is going, right? And so the another big differentiator of the difference is at the bottom on the home screen, it makes a prediction of what your weight will be tomorrow. So it's like a companion in that sense for our users to know in real time, are they moving towards their weight goal or not with a fairly high degree of certainty. So that predictive nature, where are you going from today? We tell you that in the difference.
Yeah, that I noticed. That might have been the coolest part for me. I don't know anyone else that really does that. I don't think I know anyone else that really does that. Um, Showing you like, okay, if you do these things, here will be your weight tomorrow. That's uh that's the difference, right? So
You hit the nail on the head. Yep.
that's the difference. Why is it called the difference? Is it because it's a different, app? Obviously there's play on words kind of with the difference between your weight
You
then and
know,
now.
here's the story. The alpha version, which I built myself on an Excel spreadsheet with lookup tables and things like that. Every day I would track what I had to eat, and look up in Google how many calories is a banana, how many calories is a salad, pizza. Then I'd sum it up, and that was total calories in. And I labeled, like cell C20, total calories in. Then I did my resting metabolic rate, and then I would calculate, I was working out, so I would calculate calories due to activity. And then I would sum up the calories burned while I was at rest and the calories that I burned while I was active, and I would say that's total calories out. And then it was like in cell C60, I labeled it the difference, and I took total calories in
Oh.
minus total calories out, and that was the difference. That is my caloric difference. So every day, if I had a negative number, that would be a caloric deficit. If it was a positive number, I have a caloric surplus, but I actually named that cell the difference, and that ended up being the name of the company.
Oh, there we go. There we go. That's awesome. Okay, so it sounds like a lot of the algorithm is like rule based, like formulas, right?
A lot of it is, yes.
Okay, you considering getting in on the new sexy AI trends, API calls to chat, maybe, or API calls to ChatGPT or something? Are you considering that? Are you guys considering that? Maybe not necessarily for the predictive analytics, but maybe like Gen AI to tell the user something, or I don't know. What are you guys thinking with that right now?
I mean, I think earlier on you mentioned some of the hurdles that you had using other apps where it takes a lot of time. It's kind of labor intensive to enter your data. So we hear that a lot from our customers, and any feature that we can add that decreases kind of
Hmm.
the barrier to entry of time, that the user has to expend entering the data, we want to pursue that. So, that might mean, being able to take a picture of the plate of food and the thing you're drinking and have AI immediately recognize what that is and tell you how many calories and the nutrients that are in the meal that you're having. It might mean instead of typing in banana, we already do this, by the way. You can just use the speech recognition and say banana. But we're going to add a feature in the future where you can say your whole meal. This morning I had two slices of rye toast with some butter on it, a glass of orange juice, coffee with milk and sugar, and two fried eggs. And then AI would parse out that entire sentence, make sense of it, separate it into line items, and then figure out the nutritional value for each of those things. Similarly, for activities and exercise, we'd love if the phone, if you were, let's say, kind of videotaping yourself, or not videotaping, but taking a video of yourself, if the phone could recognize the activity that you're doing and plug that in. Integration with wearables, kind of AI related, in the sense of you have to make sure that our app is talking correctly to, let's say, your scale, or your Aura Ring, or your mobile device. and interpreting the data that these wearables are collecting. So I really think you're right. There is a real room for improvement in reducing the barrier to entry of time that it takes for users to enter their data into the app. And yeah, there are other kind of more chat GPT oriented applications that can be considered, on our website, putting in a kind of a AI chat bot that can help answer questions about how to use the difference and answer questions about weight management and weight management technology. It might be able to generate meal plans or exercise routines. But as we know, with ChatGPT still in its current version, it's really all about the prompts. And if you don't get the prompts right, it's going to be kind of garbage in, garbage out. You might get some information, but if you want to get a workout routine, right now, it still makes sense. You probably want to go to a personal trainer and get the advice. If you're really strapped for cash, I suppose ChatGPT could make some good suggestions, and you could do research that way. But if you want to know how to work out, a personal trainer or a coach is going to be able to help you probably better than AI at this point, although that's fast changing. Similarly, if you want meals and recipes, you're probably going to go to a website that has recipes that have been cultivated by a chef, and learn from the chef and learn from YouTube videos and things like that. AI probably can spit out some recipes that it finds, but it probably still points to going to a professional. So, um, there are applications for ChatGPT that we're considering, but we're going to plan those carefully and make sure we do them prudently.
Yeah, no, I think that's amazing. I think that's amazing because I think it's great that you immediately think of how the AI could help your customers instead of just, oh, let's get AI on here so we can tell VCs we're using AI. Which is is an epidemic, I think, that I see in the on LinkedIn, at least, the Bay Area. It's like, so it's great. I love hearing that. Um, but yeah, no, I mean, it's all about the value at the end of the day, is what I'm getting when it comes to implementing anything. Is that correct?
Yeah, and value being defined, in what context? Is it value for our investors? Yeah, maybe, probably, but it's more so value in terms of who are we really serving? It's our customers. If we're not creating value, if and that value is, are we solving their problems? Are we making improvements in their quality of life and their longevity? If people are living longer, and we're seeing evidence of that. We did a partnership with my fraternity that I mentioned earlier, from February to July of this year. 700 brothers signed up, and we're doing a post-event survey right now, and I'm seeing some of them say things like, I ate better with better portion control. I changed my BMI classification. I'm no longer pre-diabetic. So, value, that is value. Are we creating value with our customers, tangible improvements to their quality of life? Yes. And I think that is what is going to translate over into economic value and improving the monetary valuation of the company that passes through to the owners and the investors.
Yeah, that's amazing. That's amazing. You know, and I think entrepreneurs here should take note if they're listening. Just do good stuff for your customers. I mean, and it sounds like you've done amazing stuff for your customers. This is really important stuff. I mean, I think I was in the blue zones, at a point. I was just looking up, and a common factor is, yeah, they don't eat nearly as much as we do. I think yeah, like in Japan, I think there's one in Italy, like Costa Rica. Yeah, like the a defining factor I think was like they fast more than we do. Maybe not intentionally, but like they don't eat as much. You know, it's a
Hmm. Hmm.
we're eating way too much in the U.S., aren't we? I mean, you probably doing research and whatnot, and seeing and dealing with the problem of obesity and whatnot. Like, what's the problem in America? What's going on? Why are we getting so big? Um, yeah.
Uh, I've examined the problem, and you can talk about portion sizes, you can talk about the way that we cook, the ingredients that we use. You can talk about the prevalence of certain types of restaurants that may serve less healthy food, being readily available and easily to access. You can talk about the cost of food, kind of potentially leading people to purchase less expensive, less nutritious food. There is some evidence of food waste, not wastelands, but kind of food deserts, excuse me. There's a lot of issues, but when I look at it from a weight technology standpoint, I always like thinking about it from that perspective. It's easy to eat 3,500 calories, right? You can do that pretty easily. It's hard to burn 3,500 calories. You're definitely running a marathon, and then some to burn 3,500 calories
Oh yeah.
in one activity. So yeah, so naturally speaking, a guy like you or me, I'm guessing probably burns around 22, 23, maybe 2,400 calories. So it's easy to eat that amount of calories in one day, and it's easy to go over. So I think if you're finding yourself to be overweight, one of the great things about the difference that I found when I used it, and I lost 60 pounds using it myself, was the food journal. That active listing of the food and drink that I had to eat, holding myself accountable to make a record of that. It made me more self-aware about what I was putting into my body. And I learned some macro level stuff and some micro level stuff. From the macro perspective, I gained an intuitive sense of when I was overeating and eating more than the amount of calories that I was going to burn that day. I just developed an intuitive sense over time because I was tracking the numbers and holding myself accountable. So, at dinner, instead of, having juice or a beer, I might have water. Or instead of having three slices of pizza, I'd cut it down to one, or replace the French fries with a baked potato or a side salad, something like that if I were out to eat. Then I also learned micro level stuff. Like it's really interesting to discover I like fried plantain. I'm married into a Afro-Caribbean family. And plantains, as you know, are really popular throughout South America and the Caribbean. They are essentially related to the banana, and on their own, they have a lot of calories, like a banana. But when you fry them, that preparation method also adds a lot of calories to them. So I discovered that one fried plantain had, I think, like 170 calories, just one slice of a fried plantain. So
Wow.
yeah, so
Wow.
yeah, I started replacing the fried plantain as thinking of it as a side dish to making it my dessert. So I'd eat more of the rice or beans or something like that, whatever the other side dishes were, and then instead of taking five or six fried plantains, I take two or three as my dessert. So you learn micro level information by listing and tracking and discovery.
Oh my goodness. Yeah, those that's like a fried. So that's like I think for the listener who might not know what a plantain is, I think I know what it is. It's like a fatter banana, right?
Yeah.
So like a little banana like slice, right? That you'd see on like a acai bowl or something. But they fry it and that's 170 cals.
Right around there. Yeah.
Oh my goodness. Yeah, I can see if you're snacking on those, like how many? Yeah, that's like you take like 4 or 5 of those, you're already hitting like 1,000 calories. Isn't that insane?
I want to
Oh my
fact check
goodness.
myself right now, so let me just
Oh,
hop on and double check that. I'm a stickler for correct data. So no, two of them are actually one of them it says from Nutritionix is 64 calories. So
so a
I was
lot.
off. It was the line item was eating three was about 170 calories, whereas I was eating, twice that amount or three times that amount when I would eat five or six. And when you look at a portion of rice, rice is only 210 calories. So, rice is going to be a much lower calorie count than eating fried plantain. But sorry about that. I wanted to make that correction. It's all
Yeah,
about the
I mean,
data.
yeah. Well, look, I was in the problem is it's too tasty. I was down in the Dominican Republic with my family, and yeah, they got really good food. The problem is you won't stop eating it. That's the problem. It's too good. They make it good. Yeah, but yes. Let's go on to the next question then. Um, yeah. So we're talking about we were talking about implementing different technologies in healthcare. You said you have some potential plans to use some Gen AI. But what trade offs are going on in terms of data privacy and ethical use and the patient trust? I guess for you it's like just your user trust, patient trust for providers.
Yeah,
Um,
that's a great question.
what's going
Sorry
on
that
with that?
Yeah, it's a really important area, with thinking about it for the ethics and things like that. And more attention, yes, is being paid to bias risks and data policy and ensuring that AI systems are transparent and accountable, and have some human oversight. And healthcare is one of those healthcare technology is more regulated than, let's say, airfare, air travel technology, and or there's a lot of laws. So regulatory bodies are starting to assert some oversight in places, and people are raising concerns about over reliance and the safety of AI and mental health, for example. At TheDifference, what we do is we follow best practice privacy policies and ethical practices to maintain patient trust. So we try to toe the line because, these issues are, as you said, very important.
Yeah, yeah, because I think honestly, like before I got into before I got into healthcare, I was like, okay, so someone has my data. Who cares? I feel like maybe a lot of people are the same way. Just don't like the idea of like a big brother, seeing them, or they just don't care. They were like me. They're like, oh, just take it, whatever. So like, but then I learned like you could sell the data to an insurer or something, and they could use that to like you know deny claim or not let you in on an insurance policy or like deny claims of bad stuff. Like what else do you think people should know about data privacy and all that coming from a professional background?
Um, you know, uh, you should pay attention to what data is being collected. and uh, assess the risks of that data getting out. Like so the risk of a data breach at the difference, in my opinion, is relatively low. In the sense that, yeah, there might be contact information that, if there was a data breach, like email and phone number. But in terms of the health information that we collect, um, I personally do not view it if my, information were to get out that I am 5'9.5" and I weigh 199 pounds and I ate a protein shake yesterday and I went to the gym and ran 2 miles. I'm okay with that. Um, some of the statistics that we calculate, the formula like body mass index. I'm also okay, if I think I start feeling a little more uncomfortable when some of the formula were to get out there. And now I'm thinking from a company owner, I am motivated to keep um, privacy and controls in place to protect the intellectual property of the difference because the formula for true burn, the formula for activity burn, the formula for our estimated weight change, well, that's like, our secret sauce. And I don't want that data or those formula to be breached because that is what differentiates our company. So, I champion our customers in protecting their privacy, as well as championing the company's privacy in protecting its intellectual property.
Yeah, yeah, a lot of data going around in 2025. Need that cybersecurity. If you're listening and you're in cybersecurity, it's clearly a huge thing right now. Huge, huge thing. Um, all right, next question is, you know, I think that you're part of a great new movement, shifting to preventative care. Like instead of people go to the hospital when things get too bad, and then there's a hospital system and an insurance and all this bad stuff. Instead, people with the aura, people with the whoop, people with the difference, taking taking advantage of what they can do day to day to have a lifestyle of wellness and preventative care. And so, I think there's this movement, towards preventative care, right? If you've been seeing this, from traditional healthcare to more
Definitely,
preventative care.
definitely.
Why is that going on right now? Why is that going on? Why should it be going on? What's the case for preventative care, that you would tell someone? Because I know a lot of people that are still like, oh, just live for now, and then if something happens, go to the hospital. But then I think more and more people are like you and me, where it's like, oh no, let's do things every day and use technology to be preventative. So what's going
Yeah.
on right now with that?
So this is a great question. And the first comment I have goes back to your observation about the barrier of time to enter data. So, the biggest, most helpful area for preventative health in this regard, I think, is if data can be collected easily in non-obtrusive ways, such as small wearables or mobile devices. That will really help the advancement of preventable health because it can then allow AI to interpret the data collected and identify potential problems. And as I mentioned, I think AI is a terrific tool for identifying trends with data, including indications to inform about preventative care.
Yeah, that's a very creative, I feel like, answer, and probably the best answer is in the whole preventative health thing and the whole wellness thing, to have better data entry practices, because it's just such a pain putting in all that data, right, for the AI to sort things out in a lot of cases, right?
Yeah.
Yeah, because I mean, other people. Let me know your thoughts about this too. Is that people, we track a lot of metrics with our whoops, with our Aura rings, and whatnot, but it's not taking that data and giving it to us in a you know an easy to follow way. Like I open my Aura Ring app and it just spits out like, oh, here's your all these metrics, HRV. Here's your heart rate over time. Here's this. Here's that. I'm like, what do I do with all this? Um, well, what do you think should be done on the side of like prescriptive analytics, like telling people what they should do? What are you guys doing at the difference with that?
Well, one of the first bits of advice I got when I became an entrepreneur 20 years ago was if you have an idea, don't try to boil the ocean. So, if your idea is to solve healthcare, you're probably trying to boil the ocean. If you can pick a particular problem, like, what we're trying to do is address weight problems. And we're doing it with our beachhead market is actually non-Hispanic Black women. The app is built for anyone, but non-Hispanic Black women in the United States suffer more acutely from weight problems, obesity, and comorbidities like type 2 diabetes, etc., than other demographics. So, you know, if we're hyper focused kind of on a segment and trying to solve that problem, then that gives us some focus. I'd like you to repeat the question, and then I'll continue.
Yeah, no problem. It was just how do you guys try to give what the information of like what someone should do based on the
Got it.
data?
Got it.
Like what's the best way of doing that?
So like in contrast to maybe something else where like you get your blood test results and it's just a huge long list of something. The
Exactly.
difference is focused on weight, right? So it has other use cases and we're working on expanding those features, but it really works the best for customers who have weight goals, either to put on weight, lose weight, or maintain a certain weight. And everything is kind of focused on solving that problem. We're not here to necessarily change your BMI, although people report that their BMI improves from using, the difference. We're trying to get you, if you have a goal weight, we're trying to get you there in the safest and most healthy and most clear. We're trying to be the best companion for you to do that. So it sounds like, in contrast, maybe some of the other technologies, and when I looked at the app marketplace, I found that a lot of them were a little more confusing. They were trying to do a heck of a lot, and sometimes that can be information overload. Um, One comment about our beachhead market. I know that you had wanted to ask a little bit about how AI solutions can be culturally sensitive and inclusive when addressing the needs of diverse populations. And you know, I think when using AI prompts, it's important to consider diversity when possible. And in that sense, AI is still in effect subject to GIGO, which is garbage in, garbage out.
Yeah.
The responsibility of incorporating diversity, equity, and inclusion into AI solutions in that regard, I think it falls on the company and the user of the AI technology, not the technology itself. So AI isn't going to do a good job at making sure, you, Marty, and I get brought to the table if we come from diverse populations. The company itself has to do a good job of making sure that you and I get to sit down at the table together and express ourselves as we're doing here in this interview.
Yes, 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 yes. Um, yeah, because I think there's been some interesting things that happen when demographics get left off of the training data sets. Like I think in my business school we had to do like an ethics class, and AI is the hot subject of the day. So we're talking about facial recognition, security cameras, right? Racially profiling because they simply weren't trained on enough people of a certain race, and therefore it generalizes more towards them. Like that's
Hmm.
really messed up. Um,
Hmm.
you know, it was like Amazon or delivery services not going to certain areas because of bad or biased training data. So
And
it's
I
really
guess
great
I
to hear
guess
that you're on top of that.
I guess, they there's the phrase art imitates life or life imitates art. I guess we can expand that now and say AI imitates life or life imitates AI, because I remember living in New York trying to catch a cab either to or from Brooklyn or Harlem was nearly impossible. So it kind of reminds me of, what you just said about AI maybe, having biases about sending Amazon packages or delivery drivers to certain neighborhoods. So now we have AI imitates life or life imitates AI.
Yeah, no, yeah. Generalizations, assumptions, all prejudices, all that bad stuff. It's great to hear that you're on top of it. And I think I've heard somewhere that African Americans, to what you said about your target user base right now, are disproportionately affected by obesity and diabetes. And why is that? Is it something with I don't know, diets down there, or like bad food, or what's going on? What's going on that's
Well,
causing those trends to happen?
there are some socioeconomic factors, yes. We talked a little bit about food availability and lower kind of lower socioeconomic status, a greater proportion of low income people are in housing and access to food and things like that. But there's also cultural things like, I mean, don't get me wrong, I know every culture loves food, but some cultures, the traditional recipes might be a little more calorie heavy. I haven't done that analysis to verify that, but I know that, soul food has some pretty calorie dense kind of popular items like macaroni and cheese. Although I also know that macaroni and cheese is eaten by many cultures. And so, I don't have the answer necessarily about why that's the case. I'm more solution focused. Maybe you could be critical of me and say, well, if you're trying to solve the problem, you need to understand the problem more. But the research that we've done, I've interviewed over 100 Black women to kind of talk to them about their thoughts on health and wellness and their thoughts about weight management technology and the barriers and the kind of motivators to using it. And what I've learned from speaking to this segment of the population, because I did, try to do my best to become educated about it, is that they have very limited time. They're often very busy. They might be single moms holding, a long hour job or sometimes two jobs, and they simply don't have the time to cook right, which leads to poor decisions about what to put on the table for themselves and their family. When these women are predominantly the ones who make the decisions about shopping and food and what gets eaten. So, to the extent that they are stressed out and have limited funds and things like that, that's going to carry over into health problems related to food. And in general, what they're mainly focused on is how can they eat more healthy? They want solutions that will help them do that. You know, would that mean they get vouchers or find out where their local farmers market is? Or can they be connected to healthier recipes? Or can they use the difference? Can their health insurance company make the decision to include, as a perk along with vision and dental, hey, you can get a subscription to the difference to help
As
manage
they
your weight.
should. Yeah.
Yeah. So, um, we would love to help them answer that question because that was the main question that we had and that we found in our research is how can I and my family get better nutrition? And because of the sheer number of interviews that we have done, I think I can more generalize that it's not just an individualized problem for Black women, non-Hispanic in the US. That demographic needs and wants to learn and find out more about how to achieve better nutrition and resources to do that.
You started off that answer with like, oh, I don't know if I'm an expert. I don't know if I know enough, and then you just proceeded to say, oh yeah, we did 100 interviews with this demographic, your target demographic, your biggest demographic, and you know a ton about it. And there's a lot of takeaways from that. I mean, like finding food that's quick to make, to get, etc. Finding food that's cheap. You're too humble, Peter. You're too humble. Oh yeah, that was a great answer. You're on top of this. You're on top of your market. It's great. And with that, that's about the end of the time. Unfortunately, I wish I can keep talking with you, Peter. I really, 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 really love what you do, and I think the viewers, the listeners do too. It's really awesome what you're doing. So thank you so much for coming on. Sharing your insights and experience, your perspective on the intersection of technology and health care, preventative health, what we can do to take our awesome technology and leverage it in healthcare. It was really cool seeing how like you took some things that you did in finance, some formulas and data things you did in finance, you applied it to healthcare. I don't know anyone else that does that. That's really unique and cool, Peter. So yeah,
Thank
we
you,
really
Marty.
appreciate your time and expertise. Is there anything else you want to say
Yeah,
before we
I
before we
yeah,
close it?
I did have a couple things I wanted to add. First and foremost, thank you so much for having me on your podcast. But in terms of advice for other healthcare leaders or other health technology companies, first things first, learn from other companies' successes. Secondly, if you're going to do an AI solution, I suggest enterprise level AI solution. That way you can have kind of a protected fence around your data and the prompts that you use. And regarding prompts, use good prompts. Remember GIGO, garbage in, garbage out. But if you do it right, I think this acronym could be redefined as gold in, gold out, as opposed to garbage in, garbage out. Thanks again, Marty. I had a great time speaking with you today, and forward to hearing from you in the future.
That's right. Let's turn that garbage into gold. Stay tuned for more discussions on the future of healthcare innovation. So until next time, stay well. Peace.
God bless.